Good afternoon, everyone. This is Aaron Mornham with the Montana Healthcare Foundation. It's 2 o'clock and just about time for us to get going on our webinar for the 2016 Call for Proposals. I see that there are still quite a few people signing on, so I'm going to give everyone just another minute or two, and then we'll get going. Thanks for your patience. Okay, well, hi again, everyone. Again, you're on the webinar for the Montana Healthcare Foundation's 2016 Call for Proposals, Rapid Response Round 2 Grant Opportunity. This is Aaron Mornham. I'm the CEO. And we're going to go ahead and get started. So just a few technical notes at the start. If you're hearing any echo or feedback, I'd suggest that you try dialing in on a phone line and muting your computer speakers. The phone line is displayed there on the screen. We will be taking questions during the webinar, but just to keep the phone lines clear and the audio clear, we'll ask you to submit those questions via the Q&A feature in your WebEx interface, and you'll see that on the bottom right-hand corner of the screen. Please keep in mind that for anyone who's having trouble using that feature, having trouble asking a question during the webinar, we really are here to help, and we're very happy to talk with you after the webinar if that would be helpful. So this is the this is the Montana Healthcare Foundation team. I'm Aaron. I'm here with Ted Madden, our Chief Operating Officer, Melinda Buhite, our Communications Coordinator, and Kayla Talbert, who is our Grants Administrator. So just a few logistics. We'll spend about 30 minutes talking with you about the call for proposals, and that'll be myself and Ted. Scott Malloy is not with us today, so I'll be giving his portion of the presentation. The last half of the call or so will be dedicated to questions and answers. So please get your questions ready, submit them at any time during the presentation part, and then we'll go ahead and answer them in the second half hour. Again, submit your questions by typing them into the Q&A feature on your WebEx interface. We will also be sending out an email with today's slides and a link to the recording of the presentation and responses to any unanswered questions from the Q&A session today. This is just a slide that shows how to use the Q&A feature. You'll see the Q&A icon in the upper right corner of the screen. Is that right? There. Okay, you may see it in the upper right or also the lower right-hand side of the screen. And you want to send it to the host and presenter, and then type your questions in the box that's provided there. So here's our agenda. During the presentation, we'll give you a brief introduction to the Montana Healthcare Foundation, how we were formed and what we do, and how we developed our strategic plan and funding criteria. We'll go over those eligibility and selection criteria, the funding criteria for awarding grants. We'll talk about our focus areas, and we'll talk about the nuts and bolts of how to submit an application. And we'll hope to leave nearly half of the time for questions and answers. Our goals for today are to help applications understand our focus areas and our approach to awarding grants, to make it as easy as possible for people to apply by explaining the timeline and the online application process, and to answer any and all questions you have. We really do believe in trying to be as helpful as possible in making this application process painless. So if you're having any trouble today or at any point along the way with the applications, just give us a ring and we'll do what we can to help you. So just a little bit of background on the foundation. We're a private foundation that was created at the end of 2013. We make strategic investments to improve the health and well-being of all Montanans. We have a strong focus on at-risk populations and health disparities. We're the largest Montana-based foundation that focuses solely on health. We're meant to be a permanent resource for Montana, so we manage our trust investments sustainably and make grants and grant-related investments of about 5% of the value of our trust each year. And we were created from the sale of Blue Cross and Blue Shield of Montana. We're what's called a conversion foundation. There are at least a couple hundred of these around the U.S. We're the first conversion foundation in Montana. We're independent of Blue Cross. We don't have anything to do with them anymore. We're just an independent private organization that supports health-related projects. In our 2016 call for proposals, we plan to give away more than $3 million in 1- to 2-year grants. We have 3 main focus areas for our funding. We'll talk a little bit more about these as we go on. Behavioral health, that is a term that we use to include mental illness and drug and alcohol use or addiction. Within that, we have an integrated behavioral health initiative that we'll talk about. We also make a lot of investments to support American Indian health. And finally, sort of a less specifically defined portfolio called Partnerships for Better Health, in which we're really focusing on improving value in the health system. That is, helping to improve health outcomes and contain spending on health care. We make 2 types of grants. The rapid response grants, these are grants from $10,000 to $50,000 for 1- to 2-year projects. The maximum award is $25,000 for 1 year or $50,000 for 2. And we do this through a 1-step application process. We also award large grants. The application window in 2016 for those has closed. That used a longer 2-step application process. One organization may submit up to 2 different proposals during the 2016 call for proposals. So we've had 1 cycle of grants so far this year. And just to give you a sense for how this all worked out, we had 37 proposals submitted. We awarded funding to 11. We awarded about $400,000 in grants to those proposals. The estimated amount that we have remaining for rapid response grants this year is approximately $350,000. That's a pretty rough amount. It could be a little higher, a little bit lower. At the same time, we're also in the process of a large grant initiative that, again, the deadline for applying for those larger grants has passed. But we received 42 brief proposals. We invited 16 organizations to submit full proposals, and will anticipate awarding nearly $2 million. So this is a list of grantees from the rapid response first round earlier this year. And this we decided to include in this webinar just to give you a sense for the types of projects that we're funding. Under American Indian Health, we funded a nonprofit health system to partner with a couple of different tribal health departments on an American Indian healthcare advocate program to strengthen partnerships, collaboration, and support enrollment in insurance under the ACA and Medicaid expansion. We supported a nonprofit on the Crow Reservation to work on developing a healthy local food system and improving diet. We funded the Fort Peck Tribal Health Department to expand HIV and hepatitis C virus testing services. We funded the Montana State University to partner with the Blackfeet tribe to address the issue of secondary trauma, which is trauma that happens among service providers who are taking care of people who've experienced severe injuries or domestic violence or other traumatic events. We're also funding a feasibility study to look at the use of maintenance therapy among women who are pregnant and using opioids. In behavioral health, we awarded a number of grants, planning grants to look at implementing integrated behavioral health for primary care patients in Great Falls and North Central Montana, projects to improve behavioral health awareness in Daniels County, a project to look at broader use of clinical pharmacy in the context of primary care and developing best practices. In our Partnerships for Better Health, or value-based portfolio, we funded a pilot project to expand medical respite shelter services for homeless patients being discharged from the hospital to help prevent readmission and improve health outcomes there. We funded a pilot project looking at providing fluoride varnish through a partnership between a dental, an oral health nonprofit and school nurses around the state. And we funded a project that looks at developing partnerships between low-income housing providers and hospitals based on the health benefits of affordable and high-quality housing. I want to talk a little bit about our eligibility criteria, that is, who is eligible to apply for a grant from the foundation. To be eligible, you have to be either a 501c3, that includes private foundations and Type 3 non-integrated supporting organizations according to Section 509A of the Internal Revenue Code, tax-exempt educational institutions, and state, tribal, or local government agencies. And just an important note here, if you want to apply for funding under the American Indian Health Focus Area, you need to be a tribal government agency or an American Indian-led nonprofit. Eligible applicants can plan to use part of the budget for contracts with entities that might not otherwise be eligible, so that's important. You have to be eligible as a grant applicant, but if you have a consultant, maybe an individual or for-profit company, you're welcome to use part of the budget for that in the consulting line of the budget. One other thing that doesn't appear on this slide that's important to clarify is that to be eligible for funding, you also need to be Montana-based. So only Montana-based 501c3s are eligible. So this is a list of types of activities that we will not fund. We don't provide funding for individuals because they're not eligible. We don't provide funding for capital campaigns or fundraising events. We don't provide funding that's primarily directed to retiring an operating deficit or debt. We don't fund construction projects or real estate acquisitions. We fund no type of discrimination. We also are prohibited from funding any lobbying, and our grantees can't conduct lobbying activities with our funding. We don't fund other political activities as defined in the Internal Revenue Code. We don't fund large equipment purchases in general, but I want to make a distinction there. It is possible that you can use a small portion of your grant to fund some sort of equipment purchase. That just can't be the main purpose of your request. The main purpose of the request needs to be focused on the overall programming. If you need a piece of equipment to support that programming, we might consider that in the budget. We don't generally fund medical research or research that lacks a direct, targeted, and practical benefit for Montanans' health. And we don't fund organizations or foundations that want to use our grant for redistribution via sub-grants. We have a very important restriction on supplanting. This is a tricky piece of language, so I just want to be clear on what this means. According to state law, our grants cannot be used to supplant government funding. The way we think about this is that we want to see our funding going to supplement other funds that you have, not to replace it or to be used as an excuse for a government agency or a legislature to take funding away from a good program. So we cannot supplant, which means to supersede or replace funds that you already have or are funded to do. We can supplement, that is, add to or augment funding that, that you may already have, as long as our grant is being used to accomplish some specific new outcome or deliverable that couldn't be accomplished with your current funding. These are our selection criteria, and this is just a list of the topics. We have descriptions of each of these in our call for proposals, and this is really one of the most important slides in the whole presentation. We urge you to familiarize yourself in detail with the selection criteria. This is how we evaluate every proposal we receive. So we look at the importance of the health issue. How important is this in the community? Why have you picked this particular issue? It may be a specific illness, or it may be more of a health systems issue, such as lack of services or access to care. How strong is the need? What can you say about why your community needs this grant? What is the potential for lasting change and the sustainability? That's one of our most important selection criteria. We really focus strongly on interventions that have a potential to become self-sustaining, either through insurance billing, so billing third-party payers for the service that we would help you get started, or through some sort of a shared savings agreement within the health system because you feel it's going to improve health outcomes, and then maybe a health insurer or payer or a hospital or another health system would help pay for it because of the value it generates. We focus on, again, on at-risk populations and health disparities, and these are very well defined in the call for proposals. We want to look for solutions that have been tested or that you can demonstrate should work in Montana. We really also look at the feasibility and the scale. We encourage you to apply for the right budget. If you have an immense and ambitious project and are only applying for $10,000, you might really wonder if you can pull it off. At the same time, if it seems like you're asking for a huge amount of money for a relatively small-scale project, you might not be competitive compared with some of the other applicants. So really look at the scale of the project relative to the funding, and also just overall the feasibility. Is this something that you really truly can make a case, we can do this, we have the resources and the expertise in this community, with this grant we know we can succeed. We also look at each grant in terms of how it contributes to our overall goal of funding a diverse range of organizations around the state. We don't want all of our funding to go to the largest organizations with the best grant writers. We intend to fund and do fund smaller local nonprofits, and it's very important to us to fund all over the state, not just in one area. So these are our focus areas. To develop these, we spent an awful lot of time traveling the state, talking with healthcare providers, with other health advocates, with the public health system, with tribal councils, tribal members, and tribal health departments, urban Indian health centers, hospitals, and what have you, and really learned a lot about what the major needs are. We also looked a lot at the available health data that describes the health status of Montanans and different challenges that organizations around the state are facing when trying to improve Montanans' health. Again, our three focus areas are behavioral health, mental illness and drug and alcohol use, American Indian health, and partnerships for better health, or value-based care. Talk a little bit about some of the challenges that we heard in our strategic planning on behavioral health. The state has a very high suicide rate, along with very high rates of adverse childhood experiences. There's prevalent drug and alcohol use in some populations, and also apparently, although the data are incomplete, very prevalent drug use in pregnancy in some communities. There's a shortage of behavioral health providers in rural Montana and in some urban communities as well. There are major reimbursement and funding shortfalls that may be contributing to some of those workforce challenges. There's a high prevalence of returning veterans in this state, and traumatic brain injury and post-traumatic stress are important problems for our system to be able to address and address well. Fragmentation of the system of care is a big problem. So the substance use disorder treatment system, mental illness treatment, and primary care often are carried out by entirely separate organizations that aren't located or aren't co-located, aren't funded the same, and don't necessarily work together to help give people more seamless, high-quality care. So this is just a list of examples of the types of projects that we'll consider. And I also urge you to take a look at our current grantees, which are on the website and pretty easy to find. We've got a map with all of our grantees, and it's a good place to look to see the types of things that we're funding. So and again, these are examples. This is not meant to be a comprehensive list of the types of things we'll consider for funding. But integrated behavioral health projects we'll talk about on the next slide. Other types of collaboration between mental health centers, health departments, hospitals, and community health centers to strengthen the services and improve value. School-based behavioral health programs and programs that support trauma-informed schools. Jail diversion pilot programs, prevention and treatment for drug and alcohol use in pregnancy, and partnerships outside the health sector to address some of the upstream risk factors for mental illness and addiction. So remember those grantees we mentioned from round one on housing. That's an example of one of those upstream partnerships. So the Integrated Behavioral Health Initiative is something we're structuring a bit more. For most of these grants, we're really going to let you tell us what you want to do. With Integrated Behavioral Health, we're working with the National Council on Behavioral Health and the Center for Integrated Health Solutions to provide training and technical assistance to organizations that are interested in implementing an integrated behavioral health approach. And just to define that a little bit better, it's an approach that integrates primary care, mental health, and substance use disorder treatment, generally co-located in the same building with strong coordination of care, sharing of data, and a team-based approach to improving health outcomes and improving value in the health system. We're funding under the Rapid Response Initiative, the current one that we're talking with you about, planning grants for up to 1 year and up to $35,000. Part of that budget is targeted to go to the National Council on Behavioral Health for training and technical assistance. They've been in the state working with our current round of grantees, doing a really great job. They put together a tailored training based on who you are, who your partners are, and what you want to do. But they're also going to provide a nice continuity across all of our grantees and help create a learning community and help organizations set up to be part of a group evaluation where we'll hope to show that this is a really valuable approach that's workable in Montana. So just some examples of the types of collaborations we might see in an integrated behavioral health grant. New partnerships between primary care clinics, behavioral health providers like a community mental health center, or a hospital or tribal health department, and or a school. The idea here is just getting entities that may be used to doing business separately to look at forming a new collaboration and providing integrated care. So under the American Indian Health focus, some of the challenges that we heard from stakeholders around the state: inadequate funding of health services and disease prevention, and this is a very long-standing problem and a national one, not unique to Montana. Prevalent drug and alcohol use disorders and limited availability of treatment, and fairly prevalent drug use in pregnancy in some communities from more anecdote than hard data. Challenges for young families, including historical trauma and a lack of economic opportunity and high prevalence of adverse childhood experiences. Fairly high rates of traffic injury and risks that include driving under the influence and low seatbelt use, as well as unsafe roads. Diabetes and obesity and limited access to healthy foods. Prevalent oral health problems, and also prevalent suicide and mental illness. There's also tremendous opportunities that we've found with the expansion of Medicaid and the Affordable Care Act. American Indian health providers and health systems now have a really kind of first of its kind opportunity in history to more fully fund a strong tribally run health system. And we're working a lot with tribal health departments and other tribal stakeholders to help bring this opportunity to reality. So this is just, again, a list of examples of the types of projects we are funding and will consider. If you have other ideas, they're certainly welcome as long as they meet the basic selection criteria. So we're working a lot with tribal health departments to strengthen the funding and their funding and programming, looking at how to improve Medicaid billing, how to help using Public Law 638 to contract or compact to provide services currently provided by the Indian Health Service, and other more administrative initiatives to strengthen the delivery of health care and supportive services. Looking at just even planning grants to help figure out where you'd like to take your health system in Indian country. And importantly, when I say Indian country, we're really talking about not just the reservations, but also the urban Indian health programs, which we're working closely with as well. Projects that want to focus on maternal child health, given the needs we've heard, injury prevention programs that have a high potential for being sustained after our grant, and strengthening health services for urban Indians. So under Partnerships for Better Health, we're really focused, like I've said, on improving the value in the healthcare system. And by value, we mean better health outcomes and helping to contain healthcare spending. And we focus on doing this through partnerships and innovation. Some of the challenges that we've heard of are limited access to health services in rural areas and limited workforce. It's very hard to recruit and retain staff. There are a lot of very important organizations, clinics, critical access hospitals, community health centers, community mental health centers, and substance abuse treatment or chemical dependency treatment centers. Many of them are struggling with lower reimbursements than might be optimal, workforce challenges, et cetera. So the real focus in this portfolio is how can we help strengthen each of those individual organizations through promoting some collaboration between them. Rising per capita healthcare costs are a huge problem that we're focusing on here by trying new innovations that we think will work. They'll deliver better outcomes and help reduce the use of high-cost care like emergency rooms and hospitals. Focusing on projects that, or we've heard a lot about the cost of the higher utilizers. This is often defined as the 5% of patients which account frequently for upwards of 50% of healthcare spending, and may have complex medical, behavioral, and social needs that require an innovative approach to get a handle on. And then health disparities and the social determinants of health, the challenge of how to improve health against the current of poverty, poor housing, or poor educational outcomes. So what can we do to connect the dots there? So some examples of projects that we'll consider, and again, just we'll continue to urge you to familiarize yourself with some of the grants that we've made to get a sense for what we're funding in this portfolio. Community health teams and other forms of outreach to improve clinical outcomes among high utilizers or other groups of at-risk patients. Addressing upstream risks and social determinants, for example, health-related housing needs. We've got several grants now that are focusing on trying to build partnerships between the health system and housing. Collaboration among other community agencies like local health departments, hospitals, and community health centers or community mental health centers that have a potential to strengthen a region or community's health system. Oral health programs, very important focus given the importance of this issue in many communities around the state. And then supporting the Medicaid expansion, successful implementation by supporting enrollment and navigation and effective use of insurance. So that's just a window on sort of the substance of our grant programs and what we're focusing on when we award a grant. Now I'll talk a little bit about how to apply and turn it over to Ted to talk about the nuts and bolts of the online application system.
Thanks, Aaron. We'll give your vocal cords a break. So the best way to get into the system is through the Montana Healthcare Foundation website and its homepage. You'll see a login button up on the upper left. And after you do that, you can always save that to your browser. And so our big thing here is to make sure that with your organization that we just have one user account per organization or per tax ID number. And so before you create a new account, just make sure in your organization to see if somebody else has applied. We can always add you as a user and change the applicant name on the system. So we use a third-party system, but once you click on there, it goes right to the third-party online software, and it's pretty easy to use, but we're always here for support. When you click on the login page, you'll come into this Montana Healthcare Foundation. It looks like our website, but really you're at FoundAt now, Grants Management login page. If you're a first-time user, create the account. Otherwise, this account can be used for all future applications and reporting. You'll see a list of your previous applications there. So again, just make sure that your organization already has, and if you have a question, call us and we can determine if your organization currently has an account with us. There's several main sections of areas that you'll, well, first you'll look at what application is active right now for your area of focus, behavioral health, American Indian Health, or Partnerships for Better Health. You'll see the list of open applications at any time, so please check the process or the application that best fits your project. Next, you'll just go into, and this is where you start inputting information. You'll see 6 main areas, eligibility, project title, and then we'll go through each of these briefly. The questions might be slightly different than what's on these slides, but this will give you a general indication of how to navigate the system. First, you just confirm what type of organization you are, eligibility requirements, and read our disclaimers about supplanting. Next, project title and a brief project summary of what you hope to accomplish with the project. Then we'll go and get into some demographic information. We're really interested in what type of part of the state you're serving, what population, and other demographic information that will be impacted by your project. And then the project description is really the heart of the application. There'll be several areas here to explain your project, the health needs to be addressed, the project activities. Please be specific as possible when you're discussing your activities and the outcomes of the grant. And then you can, the other essential parts are what new partnerships will be formed, and most importantly is the sustainability plan for the project. Montana Healthcare Foundation funds are meant to be a 1 or 2 year window and not ongoing funding, so this is a primary importance for us to look at how you look to, as Aaron explained, look at ongoing support for the program through cost savings and other means. Next will be the budget detail. You'll put in some information about what your total request is from Montana Healthcare Foundation, the term, and then really what the overall project is. Not your organization, but what the project is. If you have other sources of funding coming in kind, what the total project cost would be. There's also a line of what your organizational budget is. We just put that in there to get the scale of how much of this project will impact your organization. Oh, sorry. And there was one more. Sorry, we're going to go back. Also, there'll be a budget template to download, and that's an Excel spreadsheet. And again, that will ask for your total project costs and revenues for your project, both Montana Healthcare Foundation sources, other sources from other funders, or project income, and then a detail of your salaries and other type of expenses. At the end of that template, there's a short summary section where it's section J, where you can just put in specifically to Montana Healthcare Foundation how those funds will be used by line item. Feel free to call Kayla or myself or anyone at the office if you have issues with the budget or any part of the application. We'd be happy to walk you through it.
Okay, so just before we start the Q&A, which you can go ahead and start typing your questions in if you have them, the timeline for this current round is highlighted in yellow on this slide. Applications opened May 1st. Proposals are due on June 15th, and we're aiming to get funding decisions out by approximately July 15th. So again, type your questions into the Q&A feature on your WebEx interface. We are not going to answer questions about would we fund X or Y, but we can certainly give you guidance on where to look in our selection criteria to answer questions about your project. We're also happy to talk one-on-one if it seems like it might be a question that's a little too specific for a broad audience. But other than that, we're here to help and go ahead and ask your questions.
Okay, so the first question we have is, will we fund research without an intervention or a case-control trial for an intervention?
So broadly speaking, we only fund research when it has a direct, tangible benefit for the health of Montanans. So community-based participatory interventions that will, be tested, but also involve implementation of a program that you can make an argument should benefit Montanans may be fundable. We are not generally a very research-focused funder, though. We're really looking at, again, at the direct, tangible benefits. So, a lot of research that's a couple of steps removed from that might not be the type of thing that we would fund.
If we were turned down during the first round, should we keep trying or propose a different project?
You're welcome to apply again, and when you were turned down in the first round, I would encourage you to spend a lot of time looking over your proposal in relation to the selection criteria, look at the types of projects we've funded. There's even last year at the end of our 2015 grant cycle, we published a document that listed some of the common reasons for turndowns. And once you've done all of that, if you still can't really figure out why you might have been turned down in the first round, we're also happy to talk with you about your project. But, absolutely, you're welcome to apply again. One of the reasons that we turn projects down is it may be a great proposal, but we just didn't have enough grant funds, so it wasn't quite at the top of the list. So you're welcome to apply, but I really encourage you to understand the selection criteria, and what we fund, and talk to us if you have questions. We have a question from someone who wants to test a culturally tailored video. This is a fairly specific question. I think it would probably be more appropriate to take that one offline.
Our next question is, does the Montana Healthcare Foundation think that mentoring plays a role in the health and well-being of children in our state?
So I won't answer that directly, but rather to say that I think we think that anything where you can make a credible case for why it would be valuable certainly has a role. But we would leave it to the applicant to say, why do you feel this is the solution to the, what is the problem that you want to solve through mentoring, and why do you feel this is the best way to solve it? So I think that's a case we're very happy to have you make. We have no prohibition on mentoring by any means, and it's just a matter of looking at the mentoring program you envision and thinking, how does that fit within their selection criteria?
The next question is, a pilot program that has been shown to have positive mental health outcomes. Would you be willing to fund further testing of impact if we simultaneously deliver to a broader audience?
So I think, again, the main purpose of our funding is not to test the effectiveness, but it would be to deliver an effective program. So you'd have to look, looking at the selective criteria, pay careful attention to effectiveness. Is this grant going to fund something that will make a tangible improvement in the health of Montanans? If you also want to evaluate it along the way to develop a stronger evidence base for why this is important or should be reimbursable, for example, or should be more broadly implemented, then, funding for that sort of evaluation is certainly appropriate.
Our next question is, I didn't notice any grantees in the reproductive health sector except for relating to substance abuse during pregnancy. Are there any specific healthcare services you won't fund on principle, or is this a coincidence?
There are none that we won't fund on principle. We have not had a lot of applications in maternal child health. That's actually one of the reasons we called that out as an area of interest, aside from the drug use and pregnancy grantees, for which we now have 4 or 5.
Our next question is, could you please include a link to the 2015 document that lists reasons of common turndowns when you send out the email with this recording and slides?
You bet.
And we absolutely will. Yeah. Our next one is, how have you valued the concept of enhancing educational websites in previous grant applications?
So I'm trying to think back. I don't have perfect memory to remember all of the applications we reviewed to know whether we have, educational websites proposed before. I think, again, I don't think that we're in a position to define, other than integrated behavioral health, any specific type of intervention that is most likely to improve health of Montanans. We feel actually that most of our applicants know their communities better, know the needs better, and are in a position to make the case to us for why, if it's an educational website, why is this the best way or the most effective way that you have to address an identified health problem or health need in your community.
We are a new organization applying for 501c3 status. Should we apply for funding while we wait for finalizing of status?
So you can apply while you're waiting, but if you haven't received confirmation from the IRS of your 501c3 status by July 15th, when we're due to award the grant, we would not award a grant to you.
That's all we have so far. Does anyone have any more questions?
It's a great group of questions, but we've got more than 15 minutes left, so I'd encourage you all to go for it. Ask your questions.
Our next question is, we were turned down last year, but received an email saying that you would forward our proposals to other entities possibly interested in funding our project. Can you share which organizations you share these rejected proposals with, and if any other projects were funded last year?
So this is an idea that we haven't fully explored yet, but there are, as I'm sure you know, many foundations that are based in Montana or fund in Montana. And as we have those conversations, sometimes it comes up in passing, well, what kinds of proposals are you seeing? Would you, do you have any good ideas out there that you didn't fund? So we haven't done a lot of this yet, but we actually decided to include that question in the application so that we could, kind of make sure it's okay with applicants if we share their information. Because I do think one of the roles we can play beyond being the direct funder is to help connect people with maybe, other funders that we've gotten to know and who may be more appropriate as a source of funds for your project. So we haven't done much of it yet. You'd be welcome to give us a call or an email outside of the webinar, and we can talk to you specifically about your project and even think with you if we've talked to other funders that might be interested.
Question is, how do I go about adding a user account? I am writing a grant for another organization.
I think that would be best just to call our office, and we can look at your account specifically and see who the users are assigned, and we can add another user for you.
Our next question is, are your interests in maternal child health only related to substance abuse?
No, absolutely not. That's where we've received the most applications, and that's why that's where a lot of our funding has gone there. But we're certainly happy to look at other maternal child health issues.
Our next question is, because Montana is unique culturally, would it be best to suggest a partnership with the Bureau of Indian Affairs and IHS?
So we strongly encourage partnership when you want to work with American Indian population. We strongly encourage partnership with the tribally led agencies, so be it the tribal health department at a given reservation or reservations, as well as with other agencies or organizations that are important to the health issue you want to address. So the Indian Health Service and BIA could both certainly be important partners. It's important, though, we really are trying to foster strong tribally led health systems. So working with the tribal health departments and American Indian, urban Indian health centers, if you're working in an urban area, those are really key partners for a lot of health work.
All right, any more questions?
Well, go ahead and stay on the line for a few more minutes, and again, this is a great time to ask questions. If we manage to not answer your question, please get in touch with us after the webinar.
So I have another one. To MCH issues in the integrated behavioral health area, would you be interested in funding a needs assessment related to maternal mental health and discovering resources, community needs, or gaps? Or are you looking for a process closer toward an actual plan?
So we do a lot of funding of planning grants with the smaller funding. I think especially grants of $25,000 or less. We have done a number of planning-related grants. On the specific topic of behavioral health and maternal child health and the links there, that is an incredibly important public health issue, certainly, and one that could be fundable. Again, don't interpret anything I say to anyone on this call as weighing in either for or against the specific proposal idea. That we really have to see the proposal before we can evaluate it. But nothing you said there is something we wouldn't fund.
All right, our next question, is there a way to get the format of how you want information submitted without creating an account first?
If you want, you could email us at the info box, the address presented, and we could send you a PDF of the application, and that would give you guidance on the different questions. Just let us know what area of focus you're interested in.
Okay, more questions. These have been great. Very, very good questions.
All right, our next question is, we're working on a project with another nonprofit. If we write a grant proposal, should we do it together or should one of us take the lead? How do you fund proposals by two separate organizations working together? Will you split the grant or should one organization be designated as the lead on the project?
So generally speaking, only one application would be, or one organization would be awarded the grant. The other would be listed in the consulting line of the budget. And even if you're planning on a 50-50 partnership, we'd ask for you to choose one lead organization. That's the organization that would sign the grant agreement. But then within the budget, you can explain how the relationship between the two organizations works and how the funding would flow. More questions? These have been very good. Okay, we'll go ahead and hang on for another couple minutes just to give people a chance.
We have another question. If we train tribal leaders, law enforcement, IHS, and tribal college leaders on the Crow Reservation, for which we already have a grant, might you fund our attendees who want to be trained to train our work after we leave for sustainability?
So I guess, the question would depend on the specifics of the proposal. It's a little bit hard to say without understanding more about the program whether this is something we would fund or not. Certainly, if this is work that's important to American Indian health, involves very strong partnerships with the tribal leadership, And again, you know, I'd encourage you to look at talking with the tribal health department as well as the others on your list. We'd be very interested in looking at it. Again, it's hard to weigh in on a specific proposal without seeing it in front of us. I hope that helps. And again, if we're not giving you a specific answer enough on this call, we're happy to talk with you, but we won't weigh in on whether, you know, we won't give your specific project idea a thumbs up or thumbs down without seeing the whole proposal.
Is there an option for non-funded parties to participate in the training TA for a cost?
And I assume this is training in TA for integrated behavioral health. If not, you know, maybe to submit a clarifying question there. But that's possible. I think it would depend a little bit on where we end up doing these trainings and how the grantees that do receive funding for training feel about that. I think generally we're including broad partnerships within a given region. So if there's a integrated behavioral health training grant in your region, we'd hope for broad participation by different stakeholders there. Keep them coming. Yeah, this has been one of the better Q&A sessions we've had on a webinar, so you guys are doing great.
Our work develops shifts in behavior working in different thought paradigms. Oh, I see. This is regarding, this is the clarifying question.
Okay. So I think if we're dealing with the integrated behavioral health training, which is pretty specific to the idea of integrating primary care, mental health, and chemical dependency or substance use services, then you know, I think my answer stands, but it would depend a little bit on whether there's a grantee in your region.
How do we treat the Montana tribe with no reservation land?
So we do fund federally and state-recognized tribes, and I should have made that clear. So the Little Shell tribe is, to my knowledge, the only state-recognized tribe that doesn't have federal recognition. We would absolutely fund Little Shell or potentially fund a strong partnership with them. Thank you for that question. I've usually been pretty good at mentioning the state-recognized tribes, but I may have left that out. And again, we also fund tribally controlled nonprofits, so nonprofits that have a strong American Indian board, and others are also eligible for funding in the American Indian Health Portfolio. Okay. Good, we've got another one.
Can the primary amount of the budget for the grant be used for salary? Can the development of community partnerships for a specific behavioral health outcome be one element of the grant?
So the answer to both of those is pretty much a simple yes. Salary is often a big line item in our grants, and you definitely can use the grant to develop strong partnerships. We really encourage that kind of thinking. One thing to say about the use of the budget for salary, and that is that particularly for our bigger grants, we're really looking at sustainability. So if it's a planning grant and you don't need to sustain the position, that's not a big deal. If it's actually implementing a new program and you need to hire personnel to do that, we'll really be pushing on how will you sustain those positions after our grant is done. And I'll just, if you look in that key reasons for, grant turn down in 2015, under sustainability, one of the key issues there is, it's not really enough to say, we'll get more grants to support it. We're really looking for projects that can become self-sustaining for those staff positions through something that kind of connects it into the health system, whether it's through billing third-party insurance or shared savings or something like that. Okay, just been a stellar group of questions, you guys. And again, if we're not getting to your specific questions, we encourage you to give us a ring or an email. We are, really aiming to make this a smooth process. We care less about whether you can jump through the hoops of our application process than we do about funding great projects. So whatever we can do to help that happen, that's what we're here for. Okay. Go ahead, Jen.
Oh, I was going to say, please provide any input on the application process as you get into it. We try to make it pretty streamlined, and like Aaron said, not too many hoops. We've gotten good feedback before. That's why it is a rapid response cycle, that there's enough questions for us to get the in-depth knowledge of your project, but hopefully it's not too cumbersome for you, and we look forward to hearing your ideas and projects.
Okay. Well, I think that's about it. We're just a few minutes before the end of the hour, and I don't see any new questions coming in. I hope that we got all of them. Just in case we have not, please make sure to email us or call us afterwards.
And there's a great FAQ section in the on the website as well that will help answer other general questions that we've gotten before we try to add to that library regarding the application process.
Yep, thank you, Ted. That's a really good one to remember. Okay, we're going to go ahead and end the call. Thank you very, very much, and we'll go ahead and send out links to the webinar as well as the other materials we've mentioned on the call. Take care.